This segment is sponsored by Springfield Clinic. In studio today, we have Amanda Sedevy here from Springfield Clinic. Amanda, thank you so much for being here.
Oh, thank you for having me.
Yes, of course. Now, you're here to talk about a very interesting topic, Eversense continuous glucose monitor. For people at home who don't know what this is, tell us.
So a continuous glucose monitor is a device that will monitor a patient's blood glucose every 5 minutes without them having to do the traditional finger sticks. An Eversense glucose monitor is actually implanted in a patient's body just underneath the skin so that it's a lot easier for the patient to wear without any problems.
Now, is this for people that, intake a lot of sugar, or is this for anybody?
It's mostly for diabetics.
Okay.
So for just any diabetic patient, it could be type 1 or type 2.
Yeah. Why is this option maybe better or different from just the typical finger pricking?
It gives patients a lot better guide on their blood sugars and a lot more freedom from their diabetes than the traditional finger sticks of having to constantly check their blood sugars, because it gives a range and a constant checking where it checks every 5 minutes versus having a patient check their blood sugars randomly.
Okay. Is this something new, or has this been around for a while?
The Eversense glucose monitor it's the only one of its kind. It is newer, but it has been on the market for a few years.
Okay, now let's get into the results here. A lot of people, they are used to using the finger pricking system, but what have you seen? Has this been more beneficial to patients?
Yes, it has given patients freedom, and it has also given patients the ability to control their blood sugars a lot better, because they are able to see blood sugars happening in real time, so they are able to control things better.
Yeah, personally, would you suggest it over other options?
I would.
Okay.
I do suggest it to my patients, yes.
And other than diabetics, are there any other people that are battling something right now that this would be beneficial for?
Mostly right now we're just targeting diabetics for this device, but in the future it might be beneficial for other patients.
And if people at home have any questions about this, can they contact you, or how can they reach out?
They can contact my office and ask about this device, or inquire about this, or set up an appointment with myself or my diabetic learning education staff through the Springfield Clinic number, the website.
Yeah. And is this something people can do at home, or do they need to come into the doctor's office to get it done?
They need to come into the doctor's office. I do the procedure in the office. It's it's an easy in-office procedure. It doesn't take very long, and usually we do it every 3 months.
All
It only
right.
has to be done every 3 months. So.
Yeah, sounds good. Amanda, so much important information. Thank you for being here.
Thank you so much.
Of course. Okay.